Welcome to the Registry Insider. I'm Bill Seifarth, CEO and Executive Director for the National Registry of EMTs. And in today's episode of the Registry Insider, we're going to talk a little bit about the EMS Research Fellowship, which is here at the National Registry. Joining me is Jonathan Powell. He is near completion with his fellowship program here at the National Registry. So, Jonathan, thank you for joining me today.
Yeah, thanks. It's great to be here.
So as you know, obviously, we're going to talk about the fellowship program, and you're just about finished.
Yeah, thank goodness.
Defending your dissertation in February, correct?
That's the plan, yes.
Cool. So, the National Registry has research as part of its mission. Certainly, we focus on partnerships. Our bread and butter and what we are most known for is the lifelong assessment of clinical competence.
Yeah.
But part of our mission is also research, and a lot of people may not know about that. So tell us a little bit more as to what is research at the National Registry, and then tell us about your experiences over the last several years here at the Registry's research program as a fellow.
Yeah, so I also didn't know that research was a big part of the National Registry's mission or the work that was going on here. So it was news to me. But it was definitely something that once I got here and once I familiarized myself with what was going on, I almost immediately knew that I wanted to be a part of it.
Cool.
Right. So the fellowship is a structured program at the Registry, which allows you to be a full-time employee at the National Registry, benefits, all that kind of stuff. But then you also concurrently are working at The Ohio State University. Apologies for the "the." You are
Trademark, by the way.
You're also going there and you're working on your PhD in epidemiology or health policy, something of that sort. And so it's a unique opportunity, which allows you to, on the one hand, be learning about what it is that you're doing, learning the methods, learning the how-to of research. And then on the other hand, you are also applying those methods. You're working with the mentors that we have here, Dr. Ash Panchal, and you're really taking the data that's available here at the National Registry, taking that data that's surrounding the EMS community and digging into it and trying to find out, what's really happening, what's the story of EMS. And so that's kind of what research feels like here at the Registry. We're a very close, tight-knit group that like to work together, but we also collaborate. And so one of the things that I really like about this program is that while we are, here at the Registry and we have that insular group, we are also working with academics, we're working with private industry, we're working across all of these so-called lines that you might think about in typical EMS operations, and really allowing us to kind of break down those barriers and tell the story of EMS.
Fantastic. It's certainly something that's desperately needed in the profession. And honestly, I'm not aware of anyone else that's doing it. So you're one of, I think now 5 PhD fellows who have graduated from the program. Yeah,
the path has definitely been blazed before me. Yeah. So I'm following in the footsteps of some just amazing researchers. And, it's a privilege to be a part of that cadre of researchers who I really kind of see as moving the needle forward and really trying to get some answers to those questions that we've been asking for a long time, but maybe haven't had the resources to really get after it.
So how many years has it taken you to get to this point?
Yeah, so I actually accepted the position right before the COVID-19 pandemic hit. So like December of 2019.
Okay.
And then moved up right in the middle of COVID. So July 2020. So I've been here for about 4.5 years. And it's gone by in a snap, I'll be honest with you. I've really enjoyed my time here. I felt welcomed at the Registry. And one of the, really unknown fun parts of the fellowship is that you really get exposure to all the individual pieces of the National Registry. You work with the psychometricians, you work with the examinations group, you work with stakeholders. And so you really get this kind of exposure to all these different areas of the EMS community. And you learn how things really work. And you learn if you want to make changes, where are those levers? Who are the people that you need to talk to? What type of access do you need to get at that data? And here you really learn about being a partner, being a community stakeholder, and working together to solve those tough problems.
So just so people maybe get some context or perspective, and I don't mean to put you on the spot, but approximately how many publications is your name on since you've been here in 4.5 years?
I would say probably about 30 right now.
So 30 publications in 4.5 years.
Yeah.
Wow.
Again, there's significant privilege with working here at the National Registry and having access to just great minds and great collaborators. But I am, proud of the work that I've been a part of while I'm here. Of those publications, 4 of them are first author publications, which, I'm especially proud of because that allowed me to kind of take the onus and from the beginning of a study design all the way to the publication of results, dissemination of results, and really seeing how to take those results and apply it to really find meaningful change. So, you're exposed to a ton of different opportunities, and it's really just choosing to jump in with both feet and to not be afraid to learn, to not be afraid to be wrong, and to not be afraid to take that good criticism that will make you a better person and lead to the betterment of EMS as an overall topic.
So for viewers or listeners who are learning about this now, the fellowship here, where can they go to find out more information about the fellowship?
Sure. So you can go to our website to take a look. We have
NREMT.org.
Yeah, NREMT.org. We have a number of just like the general idea of what the requirements are in terms of having a degree, what type of experience you might need. But one of the nice things about the research group is that we like to talk to people. We are not a closed group. If you have interest in research, we really want to talk to you. We want to hear from you. And if you have interest in the fellowship, we absolutely want to hear from you. And we want to get your name, your email, so that we can reach out to you when we have those type of opportunities.
Can they find that contact information on the website?
Yeah, so you can find it on the website. There's also research at NREMT.org, which is our general just basket email. And anything you send to that will go to our research manager, Shay, and she'll get you in contact with the people that you need to know.
Excellent. So you made a slight reference to, what are the requirements to get in the fellowship. Can you give a highlight as to what's required to have the minimum requirements and to enter the program?
Yeah, sure. So it's a PhD fellowship generally. So they prefer that you come in with a master's of some sort, typically in epidemiology or something public health related. For me, that was public administration. I went and got a bachelor's in EMS, followed it up with a social science degree in public administration. And then when I came up here, I kind of had a little bit of a catch up to do on the statistics and the pieces that might not have been a part of the public administration program. So, once you come up and you show like how your master's degree has a impact on EMS or how you see that argument going, it's really how you package yourself and it's how you present yourself and your skills to show what you can bring to the table.
Excellent. So what's next for you now after the fellowship when you finish your defending your dissertation in February? Yeah,
so I'm excited to start with ImageTrend. So I'll be working with ImageTrend and really just being put into a position to, as an epidemiologist, start to answer some of those questions that we don't really have answers to right now, or to dig into some of the questions that we have general answers to, but we're not really sure. And we don't really know yet because we haven't accessed the data. We haven't found a way to make data replicable, to make it applicable, and to really find a way to use the mountains of data that we make every single day as EMS clinicians. And that's not just clinical care. That's workforce stability. That's the educational system. It's all of these pieces that kind of surround EMS care that all have their own individual impact. And I'm excited that at ImageTrend, I'll be able to kind of have the ability to apply what I've learned here and to really start to make that meaningful change and to apply that both on the national, the state, and the local level. Because, a lot of EMS is at the local level. One EMS system is going to be completely different than the EMS system next door. And so taking into account those individualities, taking into account those small changes to EMS systems that could have large research implications or could impact how the specific outcomes actually impact the field. Those are some of the things that I'm excited to kind of start getting into and to get into the industry piece of it.
So one thing I failed to ask you, and it's kind of out of order, but
sure,
it's okay. Tell me a little bit more about your dissertation and what you did on it and are to defend it in February.
Yeah, so this kind of comes down to two things. One is patient care and the other is documentation. And I think they're incredibly interrelated. We have to have good documentation in order on the research side to really evaluate what type of clinical care is ongoing. And so there's a lot of literature in the pre-hospital space that talks about disparities in care, whether that be by gender or by race or by ethnicity. So kind of what I wanted to get into was to take that next step. So we see these differences in pain administration. We see these differences in ACS care by gender and by race. Well, a lot of times those studies stop at this may be because of implicit or explicit bias. And so one of the things that I wanted to do was to take in that clinician piece of it and start to explore that and to see if there are any differences in care delivery based off of the demographic profile of the person who's actually delivering that care or the team that's delivering that care. And so it's going to be interesting. We're excited to really break into that. And it's not an easy conversation, but it's a conversation that I think is important because it's about measurement. And it's making sure that we are measuring things correctly so that whenever we make these assumptions, whenever we make these conclusions, that they really are applicable to the communities that we're talking about. And that when we make those changes and when we make those decisions as community leaders, that we do them with the most informed data possible. So I'm excited to kind of get into that. I'm excited to see what comes out and to figure out what those next steps are in order to have more equitable care and to have just a more fair system.
Fantastic. So again, congratulations on your accomplishments, certainly on your dissertation. It's very timely research and desperately needed research. So congrats on that as well. And thank you for what you've done for our profession.
Well, I appreciate that. And Bill, I just wanted to say thank you to you as well. I've talked about how the registry was very welcoming and how I feel comfortable here. That really is from the top down. So I appreciate just having the access and having the ability to have this fellowship and then to be able to really just take the things that we're doing here and to apply it, to push it out to the general EMS audience. So big thanks. Big thank you for, supporting the research here at the registry and for, being behind us.
Thank you. So to find out more about the research program or the research fellowship program here at the National Registry, go to our website, NREMT.org. Jonathan, thank you again for joining me for this episode. Again, congratulations on your accomplishment, and we look forward to hearing more research in the future from you.
Thanks, Bill. I appreciate it.
Thank you for watching, and as always, stay safe. Thank you for joining us for this episode. If you wouldn't mind, please click the like and subscribe buttons, as well as the notifications so you can get notifications of upcoming episodes. Also, for the latest and greatest happenings of the National Registry, feel free to go to NREMT.org. Thank you very much. And again, stay safe.